name is Dr. Lillian Ong. I'm married to a physician and I have 3 children. And the reason I like to be a dentist is because I just love dentistry. And I came from Indonesia, and there is no preventive dentistry in Indonesia even now. So when I was small, I had a lot of cavities and my teeth were so crowded, so I had to have braces. And in Indonesia, they use retainer for 2 years and nothing happened. So someone referred me to a female dentist, and I said, well, let me give it a second chance. And she did it, and she pulled 8 teeth, and my teeth became beautiful. But during this procedure, I have to see her every 4 weeks. And every time I see her, I just admired her skills, her confidence, and her expertise. And I said, I want to be like her. And that inspired me to be a dentist. So when I was 17, I decided to come to America, went to school, graduated from Loma Linda, which I think is very passionate with patients and is a very good school, and teach you to do the best for your patient and the money will follow. And that's my treatment philosophy. I purchased this practice from Dr. Eshrick, who was here for 12 years. And prior to that, he already purchased a practice from Dr. Curtis. So that's how I acquired this business, because during Carter administration, it was a big, difficult time from everybody to even own a business. But Dr. Eshrick called Loma Linda without my knowledge to check my credibility and my skill. And the teachers gave him the best recommendation that even the economy like this, Lillian will make it because she's one of the top students at Loma Linda. First 6 months, all I saw was children, because parents kind of very leery about having a female dentist, Asian. They used to see a tall Caucasian man. This is a tiny little girl, Asian. And the children, when they came home, they says, Mom, I just love Dr. Ong. And 6 months later, parents, mom, dad, grandma, they came, and it was just amazing. In about 2 or 3 years, I doubled the practice and tripled it. I believe by faith and hard work and trust and respect. I believe if patient trusts me and I trust patient and we respect each other, we can always make it. And my staff, I have a very good staff that support me along the way. My staff, mostly I train them myself. I look at their personality and character, who are passionate to the patients and compassionate about the job. It's not just a job, it's a career. Compassionate about dentistry, what's out there, that we can provide the best for the patient. Those are the kind of people that I select. And most of my staff have been with me minimum 20 years. And I educate them. We go to continuing education together. So I'm not one of those practices that just a doctor go to the continuing education and the staff left behind. I also support and pay them to get educated so that we're on the same page. The stability in a practice is important, because when patient comes here, they feel comfortable, trusting what I recommend. They know it's for their best interest. Yes, and the staff confident about my diagnosis and my treatment, and that is very important. My mission is to give you a beautiful smile with the best care and the best technology available in dentistry. My specialty is biological dentistry. I'm a little different than most dentists. About 10 years ago, about 15 years ago, one of my hygienists was sick from mercury poisoning. That was the final diagnosis. Since then, I have not practiced fillings with silver fillings. It's all white filling. I also took biological dentistry, so we can test them with material compatibility that cause some people allergy. I do whole evaluation about patient. Sometimes people have headaches. It's not just because they have migraine. A lot of things to do with your bites and your health and your muscle spasm and the way your teeth come together. That brings me to a complete dentistry that I do orthodontics. That's why I'm compassionate about orthodontics. Invisalign for those people that do not like braces with metals, so they can do invisible braces. From there, it brings to cosmetic dentistry. And I try to do cosmetic dentistry not just for the looks, but just the jaw function comfortably with the muscle and the bite, because that's very important for the stability of the patient's bite and the smile and the dentistry and the crowns and the bridges that we do. And with the advancement of dentistry nowadays, my compassionate also with implants, because I believe in preserving tooth. You know, I don't always cut patients' teeth. If they're so crooked, the teeth, I believe to intervene with orthodontics. Move the teeth to the right place before you start cutting teeth with a bunch of crowns, which is irreversible once you cut it. But you can bleach it and you can make it lined up real good, and it just look beautiful with less cost. And it's more natural for the patient and less destruction of your teeth. And they also have implants now, that we do implants. So for some places that in the mouth that they need replacement of the teeth, we don't cut the teeth, we just place implants. If you don't have enough bone, we do bone graft.
My experience in getting a CEREC crown today. I've had several other crowns by Dr. Ong. Today was more pleasurable experience. Easy, no pain, quick, fast. I highly recommend it.